This is Dr. James Cook, and the title of this presentation is an update on dermal and soft tissue fillers, Part 1. Well, we say in the medical field that the ideal filling material has the following qualities. It's physiologic, in other words, it incorporates itself within the body's tissues. It's injected through a simple procedure. It's risk-free, in other words, there's no complications or adverse effects. And it's permanent, it doesn't degrade with time. Now, we're not there yet with the ideal filling material, but we're very, very close. We have materials that are physiologic, that are placed in a simple manner, that are very, very safe. And the permanence, many of us think that a semi-permanent may be better than a permanent because if the patient doesn't like it, then they're not stuck with it. So we have a good set of dermal fillers that we can offer patients at this time. Now, numerous fillers have come and gone, and they can be categorized into biodegradable category and a non-biodegradable category. These are just some. The Zyderm, Zyplast, this is the bovine collagen that required a skin allergy test prior to use. The non-biodegradable silicone, which is illegal in the U.S. for as a filler. And so as I said, we have a set of fillers now that we think are very good and very close to being ideal. Now, fillers are used to fill defects within the skin and the subcutaneous tissue. When you hear the term dermal filler, that's usually when we're talking about a filler to be used in the skin itself. When we include the subcutaneous tissue, which is the area under the skin, then we use a broader term called soft tissue filler, abbreviated here STF. So when do we use fillers? Well, when there are scars, wrinkles, folds, and volume loss. And basically what we're doing is we're trying to fill in a depression and to try to plump it up and elevate it. When we examine the patient, we determine the depth of the defect, the problem, and then which filler is appropriate for that, and then we inject at the depth to affect a change. Now, one of the fillers that we like is Juvederm. It's not a collagen. It's an injectable that's made out of hyaluronic acid, which is naturally occurring in the body. It's not from animals like the bovine collagen was. Because of this, there's no need for a skin allergy test. Patient can come in and get it right away if the patient and physician agree that's the right way to go. And this lasts longer than some of the earlier hyaluronic acids because of cross-linking. And in clinical use, we find that it typically lasts about a year in most patients. There's two types of Juvederm that are used, the Ultra and the Ultra Plus. The Ultra is for contouring and volumizing wrinkles and folds. The Ultra Plus is a more robust formulation, about 20% thicker, and it's used for volumizing, correcting deeper wrinkles and folds. Your physician or the nurse injector will determine which formulation is more appropriate for you. And with this, we do inject into the mid to deep dermis to treat moderate to severe facial wrinkles and folds. With contraindications, there's really very few people that cannot undergo treatment with Juvederm. It's a very safe product. It's supplied in both a 0.8 cc and a 0.4 cc syringe. Both of the products are supplied that way, and your nurse injector or physician will determine which syringe is best for you. Obviously, the larger syringes are used for more moderate wrinkles, and the smaller syringes are used for more less depressed areas. And afterwards, you should avoid strenuous exercise, consumption of alcohol, exposure to the sun, and you can apply ice.